Alrighty, so today we are going to be talking about the heart, and what we have here is the sheep's heart. So I'm going to go ahead and point out some things regarding the heart here. Alrighty. Not sure if you can see kind of this glaze here on the heart. The glaze that we're looking at here is the visceral pericardium, or the epicardium, and what that is just a fluid-filled sac around the heart. It protects the heart. Alrighty, and apex of the heart here in this area, and the base of the heart here in this area. The next few items that we're going to point out is the let's see if we can get a better view here. Alrighty. Here we have the left auricle. Over here we have the right auricle. See if we can get in here. Right here we have the pulmonary artery, the right, and the pulmonary artery, the left. Under here, if you can see that, underneath the, right here, in this area, we have the ligamentum arteriorum. We have the aorta, and back here we have the brachial trunk. Alrighty. Also, as far as the left and the right atrium go, for the left atrium, it's oxygenated, and for the right atrium, it's deoxygenated. Alrighty, and that's important because the vena cava empties out the oxygenated blood into the right atrium, and the pulmonary veins are responsible for empty the oxygenated blood into the left atrium. Alrighty, so you saw the pulmonaries before, and the left and the right atrium. Alrighty, next, if you can see here, we have the interventricular sulcus of the heart. You can also see here, we'll go to the posterior view as well. So earlier we talked about the aorta, the brachiocephalic artery. We also talked about the left and the right atriums. And right here, if you look closely, you have the anterior ventricular here. Alrighty. So you Alrighty. You have the right ventricle here, left ventricle here. You have the subclavin here, the left common carotid here. So when you're taking your pulse, you go to the carotid to take your pulse. So that's what you're actually looking for when you're on the pulse wall. Alrighty, and let's see here. We also have when we're talking about the heart, some kind of housekeeping things. We have the vena cava, which is the large vein that brings the oxygenated blood. This area here. It brings the oxygenated blood back to the heart and empties it into the right atrium. So that's why you have the deoxygenated blood that's over into the right atrium. There are two atrias, as we saw, the right and the left atrium, which are two upper chambers of the four muscular chambers of the heart. And so, as you know already, the right atrium will be the atrium with the deoxygenated blood that collects the impure blood from the vena cava and delivers it to the right ventricle. And right ventricle is here, left ventricle is here. You have the right atrium, left atrium, and the left atrium collects the oxygenated blood from the lungs via the pulmonary veins, and that delivers to the left ventricle. For the two ventricles, the right and the left, they're the two lower chambers of the four muscular chambers of the heart. And the pulmonary arteries, which we saw earlier, the pulmonary circulation from the pulmonary arteries carries the deoxygenated blood from the right ventricle, to the lungs for oxygenation. And the whole point of the aorta, it's the largest artery, and for the aorta, it collects the blood from the left ventricle, and it delivers oxygen. So it collects the blood from the left ventricle, and when it's collecting that oxygenated blood, it actually sends all that blood to the rest of the organs and the muscles of the body and the tissues. So it's pumping, and it's very important that we get all of that blood. So that's why you always hear people speak about the aorta and how important it is, because it's very important that we have it, otherwise we wouldn't get oxygen to other extremities of our body. Alrighty. So the coronary circulation also, it consists of the blood vessels that supply blood and remove blood from the heart's tissue. So that's also important, another little housekeeping tool there. And when we do the dissection, I'm going to show you a few other things. So let's go ahead and cut to the internal dissection of the heart. And we'll look at the tricuspid and bicuspid here. So we're going to do a lateral cut here. Alrighty. Probably should cut a little bit more in here. Okay, you can see a few chambers here. Alrighty, awesome. So as you can see, we've cut into our heart here, and by cutting into our heart, I'm going to show you a few things. Okay. Alrighty. Alrighty, so for our heart internally, few little things that we need to look at. If you remember me speaking earlier, I spoke to you about the tricuspid and the bicuspid. So for our tricuspid, we're looking right here. For our tricuspid. And we're going to also look at the right ventricle. You can see that right here, right ventricle. You can also see the interventricular septum, which is this right here. Not only that, you can also see the pulmonary similar valve, which is up here. You can also see the brachiocephalic artery. Let's open this up a little bit more here. So we can see that. There we go. All right. The brachiocephalic artery there. You can see the, if we can pop it open a little here. Right in here, you'll see a little hole. That little hole goes to the aorta there. And actually, the aorta, it would actually come all the way down and go all the way up. And then we want to look at the pulmonary trunk, which is right here in this little hole here. And the aortic ciliary valve, which is right here. And the left atrium, which is right in here. And the bicuspid valve, just let me turn it around here. Right there. Alrighty, so you see the bicuspid and the tricuspid. So the tricuspid over here, bicuspid right there, and the left ventricle here. And you also have the trabeculae canal, which is here. Alrighty, so that takes care of everything internally on our heart. And with that being said, that concludes our dissection of the sheep's heart. Thank you.